The Trump administration wants to make sweeping changes to a federally run early learning program for children from low-income families. KY3's Connor Trett spoke with leaders from a local Head Start program where these proposed changes have some of the staff nervous for the future.
This week, the U.S. Department of Health and Human Services came out with a notice of proposed rulemaking that looks to make substantial changes to the operational requirements of these Head Start programs.
I'm a full believer in change is beneficial, but sometimes change isn't needed.
Carrie Durbin has had her children enrolled in OCAC's Head Start program for the last 7 years.
But I do feel like all parents will be directly impacted by the changes. So I'm a little worried about some of the changes that they're proposing and not sure if change is going to be good.
One Department of Health and Human Services proposal would make the parental committees optional. Dr. Joanna Seymour Brigden with Missouri State University says that those committees are at the heart of Head Start.
What happens when something is optional is that it goes to the side oftentimes. Those parent committees really give the Head Start employees knowledge of what's happening in that specific community. That's your ties to neighborhoods, needs, resources, all of those things that Head Start serve.
The Department of Health and Human Services looks to add more than 250,000 children to the program and restructure more than $2 billion in funding. Kimberly Shin Brown, the director of OCAC's Head Start, says that she fears this could sacrifice the quality of the education that the children receive.
When you're serving the most vulnerable families, removing the supports degrades the quality. Yes, it might free up some dollars and allow you to serve more children, but more children with fewer supports doesn't mean better outcomes. It just means more children and fewer supports.
Reporting in Springfield, Connor Trett, KY3 News.
This proposal for the new Head Start regulations will not be put up for a vote in Congress, but the public has until October 6th to comment. After that, HHS will use that information to determine how or if they're going to tailor the regulations. We'll have information on how you can leave a comment with this story at ky3.com.